I would like to thank those of you who are healthcare lobbyists who came to the screening today. I want to say a word on behalf of the insurance companies and in their defense before we begin this film. The law requires your industry to maximize profits for your shareholders. You are required, you have a fiduciary responsibility to make as much money as you can for the shareholders. And I'm afraid that because the law requires you to do that, sometimes the industry has to make decisions that are not necessarily in the best interests of the patients. So I don't know if you have any questions you'd like to ask before we start the screening. I'm happy to ask them. Yes. What do I hope the outcome will be? I hope that millions of Americans will realize that they're not alone, that many people have suffered through this broken system that we have, that we need to fix the system, and I want people to get involved. I want them to demand that the candidates of both parties come forth with specific health care proposals that will guarantee health insurance for all Americans and that profit not be involved in it. I hope that people support John Conyers' bill, H.R. 676, in Congress right now. I think this is, all the polls show that healthcare is the #1 domestic issue right now, and it will be in this election year. So I hope that this film adds to the debate and the discussion that takes place. And my general hope is that we have a free universal healthcare system for all Americans and that no private company acts as a middleman determining whether or not someone gets care. Yes?
Michael, if I may again, and I really don't want to filibuster, but I've been in this business for over 30 years, and so much of what you say is actually what the industry, all the industries also believe in. You know, everybody in this country should be driving a Chevy, let's just put it that way, in terms of healthcare. If you want a Lexus, you may have to pay more out of pocket. But you know, it's everybody's responsibility for healthcare. As you even so observed, and I'm proud that you're on a diet, I smoke, I should pay more for health insurance coverage. But the point is, it's everybody's responsibility. It's self-responsibility. It's the insurance industry's responsibility to be compassionate, passionate, pay the bills, look at chronic care conditions, how we can get people into smoking cessation programs, what have you. The pharmaceutical and biotech industries are keeping people alive every day. You mentioned, I'm on the board of multiple sclerosis, for example. 8-10 years ago, we had no drugs, absolutely no drugs. In fact, we barely diagnosed a case of MS. It was so complicated. Now the MRI is doing it very successfully. Now these drugs are stopping the path of progression of these diseases. You take any disease, and we all know someone that probably has, you know, one of the diseases in all the 1,000.
Right.
We all want cures, but it doesn't come without a price tag. So I hope you make money on this film. I hope you give it back to those people above the Medicaid level so that they can afford their coverage while Congress, while the public, while the industries get together to figure out the next incremental step to help those people who don't have insurance today. So please do your part as well. Thank you.
I do, as a citizen, I believe that I should be paying my taxes and that those taxes should go to guaranteeing health care for every American. I don't believe on life and death issues, it's just about personal responsibility. If your house catches on fire right now while you're here in this movie theater, I would never accuse you of your own personal responsibility to go put out your own house fire. I'm happy to pay taxes so that you will have your fire put out free of charge. You will not be charged for that. And that's what I believe. I believe that on life and death issues like police, fire, health care, the government has to guarantee this for all citizens. And it's not about how much you make or what kind of job you have or whatever. Some of us are lucky and will live a long life. Some of us will struggle through life and have many illnesses and diseases that others don't get. I want everybody to know that should they ever get sick, that they'll never have to worry about having to write a check before they get help. And that's the system I hope. that we have. Well, you'll see watch the movie
Okay,
and see what you think.
thank you.
And I will be very curious to hear what you have to say after the movie's over. So they're giving me the sign to, yes, last question.
Did you know that France has a single-payer system, and over 80% of the French have private insurance as a supplemental? And the Canadians, I believe it's about 20%. And the Canadians as well. The Germans have a system where you can opt out of their single-payer system if you make so much money. So there is a way to have single-payer and private insurance, because the private insurance acts as like a check on the monopoly of the single-payer. So
Yeah.
we should really try and go for a single-payer with some room for private insurance. Don't get rid of them altogether.
I understand, yes. Britain does not have this program. But France, Canada does have a combination.
Yes,
But,
it works well.
well, it works because it's strictly regulated by the government. The insurance companies do not make billions of dollars in profit. The problem with us here is that we have a history of insurance companies being able to operate at a for-profit level that is, at this point, obscene. And
Well, they make about 10% profit.
that-
That's not obscene.
they make billions of dollars every year, and they can only make that money by, look, you know this, it's insurance. It's a bit of a, it's like
They
Vegas.
have good years and they have bad years.
Yeah,
It's
well-
cyclical, like business.
Actually, it has great years.
Bush years, it's been very good. Very good.
Very good during the
Clinton
Bush
I was
years.
in the dog.
A year after Katrina, when you all told us that you were going to go bankrupt, one of your best years ever. You guys do great. And
Reform, I'm a reformer.
where are you from?
Healthcare reform, I'm a single-payer guy.
Oh, you're okay. Really? The man's confusing me down here. But you're right, but it's all about single payer, and there's different
Yes.
ways to do it. Different countries have tried different methods. Here's my shorthand to this. Each of the single payer systems, or what they call socialized medicine, each of these systems have their flaws.
Yes.
Each of them have problems. What I would like us to do as Americans is, instead of, we always talk about the problems of the Canadian system, or the British system, or the French system. Why don't we go and find the one thing the Canadians do right, the one thing the Brits do right, the one thing the French do right, and pick and choose here, and make our own system. Put them all together into a melting pot and call it the American system. You know, there are other solutions out there.
Yes.
We can come up with a better solution. I mean, I don't deal with this in the film, but Taiwan is a good example of a country that had a system like ours, decided to switch over to a universal healthcare system, and it's working just fine for them. And they're a very capitalist country. So there is a way to do this to guarantee that all citizens are covered, and so that there is controls and regulation so that nobody makes off like bandits at the expense. And certainly, no insurance company should ever receive a call having to make the decision whether a person should receive treatment or not. That decision should be between the doctor and the patient in the hospital, not the insurance company. You would agree with that?
I agree.
Thank you. All right,
Thank you.
we're going to start the movie. Thank you all for being here. I hope you enjoy it. There's no car chases, but otherwise, it's a good movie. Thank you very much.
Can I get an autograph?
Just give us a second. Just why is it that health care is so important? With everything going on, the war and everything else happening, why choose health care at this moment to focus on?
You know, there's a member of parliament from Britain in this film, and he says, you know, if you can find money to kill people, you can find money to help people. They've found the money to do this war. I don't ever want to hear again, we don't have the money to take care of our own citizens when they get sick. Gotta go.
Thanks a lot.
Thank you.